Well, ladies and gentlemen, welcome. It's not precise as live television. We are 48 seconds late. But welcome to those who are watching online, and apologies for those who are in the hall, because it's always much nicer to talk and sort of sit down in a nice organic way rather than be dragooned like this. I should start actually by acknowledging that this might be the very last HealthSense award ever. And I'll come on to that in a moment. It looks like we might merge. I don't think merger is quite the right name. We might be absorbed by another organisation with which we share very similar aims. The, in fact, the name Health Sense might disappear, which is those of us who've been with it for a long time are upset about, but there you go. There's an old story, and it's true, incidentally, about the merger between Daimler and Chrysler, when a television interviewer asked the boss how the new name was going to be pronounced, and the boss said, "Chrysler is silent." That may happen to us, I'm afraid. But this is still a venerable organisation in some respects. We go back to 1988. Now, it's true that the Royal College of Physicians goes back to, I think, 1518. And I think the Royal Society, does anybody know? I think it's 1650, 1660, something like that. Even so, compared to them, we've only just got going. But we've been here a long time. We've got a lot under our belt. There is still a little that we can't take credit for. It is true that we have a king who swears by homeopathy. And in the United States, they've just got a new Secretary of Health who swears against vaccines. But, you know, we're not going to win it all. We have, for a long time, one of our proudest achievements has been our student prizes, which have gone to some really great clinicians in the making. And, of course, our award, the main Health Watch Award, has gone to some very, very distinguished people, some famous scientists, brilliant researchers, to people who've called out very poor methodology or even research malfeasance, actually. Popular explainers of why evidence matters. Actually, it's gone to forensic examiners, it's gone to a whole range of people. But it has been a fantastic 33 years, of which we are very, very proud. And above all, some very, very brave campaigners for evidence-based medicine, because it does sometimes take bravery to push the evidence basis against the ideology. And my heavens, we've seen that over the last year or two. May I make a particular welcome? Where has he gone? Ralph Tomlinson thank you, Ralph, from the Royal College of Surgeons of England. The RCS has supported these awards, and incidentally, I said this last year, but I'm going to repeat it. The Royal College of Surgeons is truly world-beating in the way that it is creating evidence-based medicine, evidence-based surgery. When you say to people, but they're doing a great number of randomized trials. People say, you can't do randomized trials in surgery. Oh, yes, you can. And the RCS is proving that you can do it. And if only enough social scientists could see, who say you can't do it in social sciences, if only they could see you can do it in surgery to the extent that they're doing, the world would be a better place. So let's start tonight with the student prizes, which are, from now on, called the Richmond Prize, in honor of Caroline Richmond, one of our founders, one of our absolute stalwarts from the beginning, who would have frankly deserved the Richmond Prize on her own. Her husband, Jim, is here, right in front of me. Jim Egg is right here. The purpose of this, I think pretty much everybody, until they get into medicine or until they become quite sophisticated about these fields, assumes that everybody to do with clinical practice is trained to tell what's good evidence from bad evidence. After all, these are the people, whether they're allied health professionals, whether they're nurses or midwives, whether they're surgeons or whether they're doctors, who are going to give us the best advice, but not only that, who are going to take the best advice themselves for the treatment that they give us. And yet it is extraordinary how many medical schools have failed on this basis. They say that the curriculum's too full. And I think a particular word of ignominy should go to the Nursing and Midwifery Council, where again and again they've said our curriculum is just too full. We can't find time to tell nurses and midwives what's good evidence and what's bad evidence and how to tell the two apart. Thankfully, a lot of nurses and midwives in training say, well, we're going to try and find out anyway. And that's brilliant. And that's what the Richmond Prize does. It sorts the wheat from the chaff, or at least it tries to. Students are given a research protocol, or a series of research protocols, and they're asked if they can tell the good ones from the ones that have flaws in them. Some of the flaws are subtle, some of them are barn door open mistakes. And it's extraordinary how many students who think they can do this and have partway through medical school, it turns out can't tell a howler, an absolute open howler. I find that rather depressing. But what is exciting is I think the standards are improving. I don't know if this prize, I like to think this prize has something to do with it. And we have 5 exceptional clinical students tonight who've all done really, really well. And I've got some prizes here to hand out to them. Let's start with allied health professionals. And will you please welcome from the University of Glasgow, actually, sorry, he's from the Birmingham University, I think it is. I think it's Birmingham. You tell me where. She is. Dervia. Where are you? Dervia Murphy. Come on up. Is it Birmingham?
It's Birmingham City.
It's Birmingham City. Okay, Dervia, congratulations.
Hi.
Just tell us briefly why you went in for the prize.
So I think one of the lecturers put out the flyer, and it just piqued my interest. I thought it looked interesting. I had a look at the protocols and thought I'll give it a go. We actually do some systematic reviews at Birmingham City University. So I'd had some experience appraising papers, so I was kind of putting them into practice again, which was nice. And I didn't expect to win, so this was a nice surprise.
Congratulations. Dervia, thank you very much.
Thanks.
Well done. So now we've got 3 runners-up for the medics, and this one, actually, I can say this is now, I think it's University of Glasgow. We're going to find out in a minute. That's Matthew Wei-Shin-Lin. Matthew, come on up. Congratulations. Matthew, I think you got a highly commended last year, didn't you?
Yeah, I just graduated this year, so I think that's the end of it.
Congratulations. Thank you very much indeed. Thank you. And from Imperial College London, will you welcome Kinna Weber. Kinnan. Now, Kinnan, I discover online, has won a whole series of prizes already at his own college at university, so welcome to another one. The other thing about Kinnan, you should know he's a Syrian refugee, came here not speaking much English.
Yeah,
which
well,
says,
I do now, but not that much. Yeah.
Which says a great deal about the value of people coming to this country, even though they don't speak a great deal of English. Incidentally, my father was the same. So anyway, welcome and congratulations.
Thank you very much.
Thank you. Actually, I might have, in the sophistication of my way of doing this, I might have given you the wrong one. Can I?
But it says, you know, this one.
Sorry?
It says my name.
It does say your name. That's
You might have one extra one because Amina is not here. So
Which one? Who's not here?
Amina's not here. Is that Eduardo?
No.
Oh, I think Matthew's got
Matthew,
Eduardo.
have you got Eduardo's? Right. You
It's a little swap.
can see why I no longer work on TV. Thank you very much indeed. Well, I know who this is because it says so. Eduardo, why don't you come on up? Eduardo. Eduardo, well done. From UCL, yeah?
Yeah.
My own university, as it were. I'm working there. Thank you very much indeed, and well done. And the winner The winner actually did remarkably well. I mean, it was hard to fault anything that he did. He is from the University of Cambridge. His parents are attending. I think they're here, are they, Anthony and Barbara? Yes, they are. They're the proud parents, and we're proud to have him as our winner. Ladies and gentlemen, Alex Fleet. Alex. Just come and tell us again why you did it and what got you interested in this. Of course, where you are, they do teach quite a bit of. In fact, you don't see patients until you're about 6 years.
Not many for the first 3 years.
Yeah,
No.
absolutely. Yeah. But tell me why you were interested in entering the competition.
I'm really interested in research in general, and so I thought the competition was a good opportunity to develop and test out applying some skills of critically analysing protocols. And yeah, apply those skills to some example protocols.
Do you think most of your colleagues would have been able to do it as easily as you did, or?
We do get taught, to some extent, some skills in critically analysing research, but a lot of that is focused on more fundamental science in our first 3 years. There's not quite so much emphasis on analysis of clinical trials at the moment.
Yeah, well, good for you. Alex, well done. Thank you very much.
Thank you.
Congratulations. So now to the HealthSense Prize. As I said, the Richmond Prize, whatever happens, is going to go on. We're absolutely determined about that. And even if we do fold in with another organisation, there will be a Richmond Prize next year, the year after that, and the year after that. Whether there will be a HealthSense Prize under another guise, I'm not sure. As I said, we've had some fantastic winners of this. I was just writing down a list of them, and all of them in their own way have done so much for evidence-based medicine or for exposing quackery or bad science in one form. And some of them, just like Dame Sally Davis, just done so much for medicine generally. But they include John Diamond, for those of you who remember, the journalist, who did so much to expose in the cancer treatment. He was dying from cancer himself, the good treatment from the bad, and had a huge effect on the way that oncologists themselves treated patients, because here was the voice of a patient who was dying, and he was so eloquent and had such an effect on so many patients in the future. There's Tim Harford and his Radio 4 team doing so much to expose just the sort of things we're talking about, how you tell good evidence from bad. Mike Baum, Ray Tallis, Deborah Cohen, a whole range of others. This year's winner, as I say, perhaps the last in this Hall of Fame under the present title, works in a field which is close to my heart, stem cells. Stem cells, as most people in this room, well, everybody in this room who's a medic or a scientist, biological scientist will know, are almost the next thing to a magic wand in medicine. It is just extraordinary, the potential for stem cells. The problem is that there are an awful lot of people out there who are selling an awful lot of stuff at a very primitive time of our research, our understanding of how to use stem cells. And it's quite a jungle out there. And this year's award winner leads the charge against the fraudsters. And to introduce her, will you please welcome actually someone who's a HealthSense Award winner himself in the past, Peter Wilmshurst. Peter.
Well, thanks very much. I'm delighted to be able to introduce Patricia Murray, and I'll just tell you a little bit about her. I know that for the first 7 years of her career, she worked as a nurse in Liverpool, Royal Liverpool Hospital on the head and neck unit, and in 1994, she went to University of Liverpool to do a BSc, graduating in 97 with first-class honours in molecular biology, and she was awarded the prize for the highest attainment at the University of Liverpool for anyone taking a life science degree. She was the only person ever to have scored 100% in the 7-hour data analysis exam, and she then undertook a PhD at Liverpool University in the field of stem cells, And in 2002, she was awarded a Royal Society Dorothy Hodgkins Fellowship that enabled her to establish an independent research group. She's built up her research career in Liverpool, directed 3 EU-funded international research training programs, and has led investigators in the UK Regenerative Medicine Platform Safety and Efficacy Hub, focusing on imaging technology. She successfully supervised 32 doctoral students and 10 postgraduate researchers, and she was awarded a professorship in stem cells and regenerative medicine in 2015. Now, that's the background. Trish's interest in scientific research, scientific integrity and research ethics. She's opposed to the inappropriate use of stem cell therapies and has advocated for stricter regulations to protect patients. Her concerns regarding some high-profile cases have been reported in Science, the BMJ, on the BBC, in those strange bedfellows, the Daily Telegraph and Private Eye, and on the Better Science blog. After making her concerns public, she's received cease and desist letters from lawyers threatening legal action from 3 UK companies, Regen, which is a tracheal transplant company, Onconogen, a company established by struck-off dentist Anjan Reginald and Nobel laureate Professor Sir Michael Evans, and the Harley Street Clinic, which, the Harley Street Skin Clinic, not the Harley Street Clinic, that's a different body. The Harley Street Skin Clinic, which actually doesn't just treat skin diseases, even though they're not really got expertise in it, but they claim to treat other things besides skin diseases with stem cells or bogus stem cells. And she served as an expert witness in the trial of surgeon Paolo Macchiarini, who transplanted so-called stem cells, engineered tracheas into patients with fatal outcomes, and he was sentenced to 2.5 years in prison for the patient abuse. So I'll leave it to Trish to speak further. Thanks.
Before you do, Trish, I have the right envelope this time, even though it's upside down.
Oh.
Congratulations on the award.
Thank you so much. It's such an honour to be, to be awarded this prize. Especially looking at some of the previous winners, and I'm just really thrilled to be here. So I'll get on with my talk. Oops. Okay. So I'm going to start my talk by telling you about 2 landmark events in the area of stem cell research. And I think these 2 events have really played a key role in bringing stem cell research into the public domain and have played a big part in the expansion of this field. So the first landmark event was the...
Put that down for you a bit.
Oh, thanks. Was...
All right. Is that all comfortable?
Yeah, that's great, thanks. So the first landmark event was the isolation of human embryonic stem cell lines. This was by an American group led by Jamie Thompson. And the reason this was so exciting was because embryonic stem cells are what we call pluripotent, which means they can generate all of the cells, tissues and organs in the body. So after these were isolated, there was huge optimism that these cells could be used to treat a range of conditions in humans, such as Parkinson's disease, type 1 diabetes. And the picture you see there is of a very early embryo before it implants into the uterus. And the embryonic stem cells are in that little mass that you see at the side there. But one of the problems was that the procurement of these embryonic stem cell lines required the destruction of the embryo. And this raised some ethical concerns, especially for people who believe that human life begins at conception. And even today, there are some countries where it's not possible to isolate human embryonic stem cells. And this brings me to the second landmark event, which was in 2002. And this was a study led by Catherine Verfaye, who was in Minnesota at the time. And she published a paper in Nature claiming that pluripotent stem cells could be found in the bone marrow. And this got a huge amount of media attention because it seemed to be the answer to the ethical issues surrounding the use of embryonic stem cells. And the paper has been cited over 4,000 times. But the problem was that nobody could repeat this research, and problems were found with the data. But it's only recently been retracted, and it's actually the most highly cited retracted paper. And although these cells were first found in the bone marrow, researchers were then finding them in other tissues such as adipose tissue, tooth pulp, and umbilical cord tissue. We now know that these cells are not pluripotent, and they're not cells that can generate new tissues and organs. But the media hype around this study gave patients and members of the public false hope, really, that they could be used to treat a range of diseases in human beings. And as a result of that, there are thousands of clinics now worldwide marketing unproven mesenchymal cell therapies to patients with a whole range of conditions. And we've just recently published a paper in Prometheus, and Peter was a co-applicant on that paper, highlighting the situation in the UK. So in the UK, most of these clinics are offering unproven mesenchymal cell therapies for arthritis, and there's absolutely no evidence that it works. And this study was also highlighted in an article in iNews by Claire Wilson, who's also in the audience today. But what I'm going to talk about today is the effect of the mesenchymal stem cell research in the trachea transplantation scandal, because the false evidence that these cells could be pluripotent played a very big part in the belief that they could be used to generate a new airway for transplantation into patients. So the key paper here, which is where it all began, was a paper that was published in The Lancet in 2008. And the key players that you see on the bottom here are the two surgeons, Paolo Macchiarini, who was based in Barcelona, and Martin Birchall, who was based in Bristol at the time and is now based in UCL. So these surgeons, undertook the transplantation. And then Anthony Hollander, who's a basic scientist, played a key role in generating the so-called bioengineered trachea. And Anthony was based in Bristol at the time, but is now based in Liverpool. So what was actually done in this study? So a donor trachea from a deceased donor was taken and decellularized using detergent and enzymes. Mesenchymal stem cells, as they were then called, were then taken from the patient's bone marrow and used to generate chondrocyte-like cells in the laboratory. And those cells were then seeded on the outside of the trachea. And the idea was these cells would generate cartilage, which would enable the airway to maintain its structural integrity. Cells were also taken from the patient's airway, and they were seeded on the inside of the decellularized trachea. And the idea is that they would generate an epithelium following transplantation. The trachea was then cultured in a bioreactor for 4 days and then transplanted into the patient. And because the trachea had the patient's own cells, there was no need for immunosuppressants. So this was hailed as a huge success, and this is a key statement from the paper. The graft immediately provided the recipient with a functional airway and improved her quality of life and had a normal appearance and mechanical properties at 4 months. But shortly after the paper was published, some questions started to be raised, and Pierre de Lara, who's an ENT surgeon in Leuven, was one of the very early critics of this intervention. And these are some of the key questions that were asked. Had the patient's cells really integrated? Had those chondrocyte-like cells really form cartilage? How did the trachea stay healthy without a blood supply? Did the trachea maintain its structural integrity? Had the approach been tried in animals? And had regulatory and ethics approval been obtained? But despite that, it was hailed as a success, and the world's media celebrated this operation, and 11 more patients had a very similar procedure. One of the key things, though, is with Claudia Castillo, who was the first patient, her problem was that she had a narrowing of her left bronchus as a result of TB. So the trachea that was made for her was used to replace her bronchus. Most of the other patients, the trachea replaced their actual trachea. And then, following some of those interventions on patients, which were all done under compassionate use, UCL researchers led by Martin Birchall, and sometimes in collaboration with a UK company called Viderigen, received funding, ethics and regulatory approval for 3 clinical trials. The INSPIRE trial was a trachea transplant trial, phase 1, TETRA was a phase 2 trachea transplant trial, and RegenVox was using the same technology, but this time to replace the larynx rather than the trachea. Macchiarini stopped using that approach for trachea transplantation, and shortly after the first operation, he moved to the Karolinska Institute, and he switched to plastic tracheas. So instead of using a trachea from a deceased donor and then decellularizing it, he made tracheas out of plastic and used the bone marrow to, the cells from the bone marrow were seeded onto the plastic trachea, and the idea was that that would turn the trachea into a functional organ. And this is a picture of Macchiarini with the very first patient who received a plastic trachea transplant. It's Andamarian Bayen, who had a slow-growing tumour in his trachea. And shortly after the operation, the case study was published in The Lancet. That was 2011. And a key statement from the paper was that 4 months after transplantation, the patient is asymptomatic, breathes normally, is tumour-free, and has an almost normal airway. And 9 patients received plastic tracheas in total. But not that long after, some of Macchiarini's colleagues in the Karolinska started to raise concerns about the outcomes of patients who had plastic trachea transplants. And this was published on the For Better Science blog. But the concerns were initially brushed under the carpet, and they themselves were threatened with legal action, and their careers were threatened as well. And of those 9 patients who had the plastic tracheas, 8 died and 1 could be rescued. So the reason they could be rescued was that that patient, the plastic trachea was only a short segment. For all the other 8 patients, the plastic trachea extended into the thoracic cavity and sometimes replaced some of the bronchi as well. So those patients couldn't be rescued. Then in early 2016, a documentary was aired in Sweden, which really went into some detail about what happened to the patients and documented the suffering and death. And around about the same time, an article was published in Vanity Fair highlighting some issues with Macchiarini's private life. So he was proposed to marry a journalist called Alexander Benita, who you see there, who was making a documentary about him, and he told her that the Pope would be at the wedding, Elton John and all sorts of people, when actually he was already married. So both of these things happening at the same time really brought the whole scandal into the public light. And then not long afterwards, the head of the Karolinska resigned. Macchiarini was dismissed from the Karolinska, and then investigations into what happened to his patients and into his research articles, began. And that paper in The Lancet in 2011 was then retracted. And that's the statement that I read out to you before. So there was a claim in that paper that the patient had an almost normal airway at 5 months. So on the left there, you can see what a normal airway looks like, and the arrows there are pointing to the blood capillaries. On the right is what Andamari and Bayen's airway looked like after 2.5 months. So what you're seeing there is a plastic trachea, and the blue sutures that you see is where it's being sutured to the native trachea. And I think you probably don't need to be medically trained to see that that is not a normal airway. On the right, it's almost completely closed off and very narrow on the left. And you can see a lot of secretions pool in there. And that's because the airway didn't have an epithelial lining. So there was no way that, those secretions could be cleared. What happened with all of the patients who got plastic tracheas was that not long after their operation, the plastic trachea would start to separate from the native airway, and they would end up with a fistula. So when they breathed in, air would be going into their chest cavity. The plastic airway would also wear a hole into the esophagus, so they would end up with an esophageal fistula and then wouldn't be able to eat or drink. So most of these patients, really suffered quite terribly. And I think that's why there was so much outcry to the documentary. It wasn't just that the patients died, it was the degree of suffering that they were subjected to. So Macchiarini eventually was brought to justice, and in June 2023 he was sentenced to 13 months in prison, and we believe that he is now serving that sentence in Spain. After the issues with the plastic tracheas came to light, questions then started to be asked about, well, what happened to the patients with the cadaveric tracheas? And I was particularly interested in the outcome of the patient who had the very first trachea transplant, Claudia Castillo. And that was because I used to talk about this paper to my students, my year 3 students, and I wanted to know if what I was telling them was correct or not. So I started looking online, and I came across Leonard Schneider's blog, and he had a story about Claudia's trachea, and that was published in 2016. And it was very clear from that story that Claudia hadn't done as well as was claimed in the Lancet paper. And further investigation showed that Claudia's graft had actually collapsed after just 3 weeks. Now, the reason Claudia didn't die was because the trachea she had replaced her bronchus, so she could still breathe through her other bronchus. There was also no improvement in lung function, as was claimed in the paper, and the graft had to be removed together with her left lung. So we now know that that key statement from the paper was false. And what happened to the 11 patients who had this procedure after Claudia? 9 are dead, 1 is a survivor, and 1 is unreported. And what about those trials that were planned? So in 2016, UCL said that they were going to conduct a special inquiry into their role in trachea transplants. And surprisingly, when they published their report in 2017, they were recommending that the trial should proceed. So this was an independent investigation. But for people who kind of knew what had happened to the other patients, it was very surprising to hear that, you know, the trials looked like they were going to carry on. So at that point, myself and my colleague at Liverpool, Raphael Levy, wrote a report for the Science and Technology Select Committee. So fortuitously, the committee was conducting an inquiry into research integrity. So Norman Lamb was the chair of the inquiry at that time. So this enabled us to get our concerns into the public domain. And then in 2018, the story was picked up by Science, and they kind of made our concerns public. Around about the same time, our university received solicitors' letters from the company Viderigen, who were collaborating with UCL on the trials. We passed those solicitors' letters to a journalist called Nigel Hawkes, who wrote a paper about it in the BMJ. And after that, we didn't receive any more threats. And thankfully, the trials then didn't go ahead, but it really needed that public exposure. And a lot of people have really put some effort into trying to get that original Lancet paper retracted. So myself, Raphael, Leonard, and Peter Wilmshurst wrote an article in the BMJ in 2022 asking for this paper to be retracted. And in October 2023, it was finally retracted. But that was really thanks to the Swedish National Board for Assessment of Research Misconduct. So this organisation in Sweden was set up after the Macchiarini scandal, and it was really to so that, you know, if anybody had concerns about research articles, they could complain directly to this organisation, because it was recognised that institutions aren't very good at policing themselves. We had written to the Lancet on many occasions. We'd written to COPE, the Committee on Publication Ethics, and we'd also written to University College London, but, you know, that was to no avail. So another question was, had these bioengineered tracheas been tested on animals before the Claudia Castillo case? A Daily Mail article in November 2008 suggested that Claudia had been told that the procedure had been tested on pigs, because Macchiarini had brought her to see some pigs who'd had a scar on the back of the neck, and was told that they'd had the same procedure, but actually they hadn't. And then Macchiarini and Birchall published a paper in 2010 claiming that they had done the procedure on pigs. So they said, it was more or less the same method for preparing the trachea, and they'd implanted it in the same way, and that it worked out very well for the pigs, and they didn't need a stent. But there are many problems with this paper. I mean, scientifically, it's completely implausible. There are many problems with the data, and part of the methodology is known to be fabricated. Apart from that, Anthony Hollander, who played a key role in Claudia Castillo's transplant, has made it very clear in the book Contested Cells that no animal experiments were conducted before Claudia Castillo's procedure. And we've asked UCL and the Lancet, sorry, not the Lancet in this case, it's the Journal of Thoracic and Cardiovascular Surgery. We've asked them to investigate and, they've refused. So who were the UK patients and what happened to them? So one patient was Keziah Shorten, and she received a cadaveric trachea from Macchiarini and UCL doctors in Italy in July 2010. Keziah had a tumour in her trachea. And then 2 weeks after recovery from the operation, she then came back to the UK and was then looked after by the UCL team. For reasons that aren't clear, in December 2010, the UCL team removed Keziah's stent, and of course it immediately collapsed. And then when they tried to open up the airway again, they ripped a hole in it, and that, basically she had catastrophic complications. Macchiarini advised them not to remove the stent, but they did so anyway. And you have to bear in mind that Martin Birchall would have known that Claudia Castillo's graft had collapsed after just 3 weeks. In October 2011, the UCL team decided to use a plastic trachea on Keziah. Again, Macchiarini advised against that because by this time he knew that Andemarius Bayen's trachea had failed, but they went ahead and did it anyway. And as with all the other patients, the plastic trachea started to separate from the native trachea, and Keziah died in January 2012. And these are just some statements made by Keziah's father, pointing out that basically on a daily basis, Keziah's artificial trachea would become blocked, and she would almost suffocating on a daily basis. Another patient was Shauna Davison. She was a 15-year-old girl who was born with a very narrow trachea. So she received one of the cadaveric tracheas from the UCL team in Great Ormond Street in February 2012. So that was just a month after Keziah had died. And a stent was not inserted in the trachea at the time of the operation. And then just a few weeks later, the trachea collapsed and Shauna suffocated and died. Now, Shauna's trachea was prepared by a PhD student who was being supervised by Martin Birchall and Mark Lodell. And I think it's important to point out that Macchiarini had no role in this transplant. Martin Elliott was the surgeon who led the surgery. Now, the trachea that was implanted into Shauna was decellularized using a technique that had been patented by the company Viderigen. And the trachea was frozen and then thawed before it was implanted into Shauna. Now, the team in UCL had done experiments with pig trachea to show that if you froze them and then thawed them, you weakened the structural integrity by 50%, so they were much more likely to collapse. But knowing that, they went ahead and implanted it into Shauna and a stent wasn't placed. So Birchall and Lodell should have been aware that Shauna's trachea was highly likely to collapse. And I've complained about this to UCL, but they've refused to investigate. And they've told me that this is a matter for Great Ormond Street. Martin Elliott, who was the surgeon in Great Ormond Street, who was the lead surgeon, has said that he was persuaded not to place a stent in Shauna's trachea. So a big question I have is if Martin Elliott was aware of the results of the experiments with the pig trachea. Martin Elliott has said since in an interview that he was very much influenced by that Lancet 2008 paper, and that him and his team have been very damaged by it. It's also likely that he was influenced by the pig paper as well, because he cites that in the case study written about Shauna. This is a picture of Shauna before her operation, and it was taken from a tribute page in a local newspaper after her death. What I found quite shocking was that the team took that photograph and cropped it. It then appeared in a research article where they boasted that this was the first time they'd used a trachea that was prepared under good manufacturing practice conditions. Now, I think it's the reason they've cropped the photo the way they have is to cut off the trachea, because of course if someone had a trachea transplant, then they shouldn't need a trachea. So this really seemed to be, gross exploitation. And these are some statements from the paper. Her immediate latency and quality of life dramatically improved. She died of unknown complications 2 weeks after discharge. And of course, that wasn't true. And then in another paper, they said she would almost certainly have died much earlier if untreated. I'm bearing in mind, she had a good quality of life before her operation and died just 2 weeks later. So the Shauna Davison case was covered by Newsnight by Deborah Cohen, who was a previous awardee of the HealthSense Award. And these are some excerpts of the written piece that accompanied the Newsnight article. These are some statements by Shauna's mother. So Shauna was in Great Ormond Street for 2 weeks and then was transferred to Leeds. And I find it quite puzzling that the team decided to discharge her to Leeds, even though they knew that the trachea was already becoming soft at that time. So during the transfer, Shauna's mother said, she thought it was strange that Shauna seemed to be coughing a lot. And then the next day, Shauna started to suffocate and was asking for help, but of course couldn't be helped. And that's something that's really, had a very lasting effect on Shauna's mother. And you can see the Newsnight article, if you're interested, where you see the interview with the mother. Now, just a few months later, so after those two patients had died, in June 2012, Martin Birchall and Mark Lodell and one of their colleagues, Adrian Thrasher, wrote a piece in The Lancet where they were saying that actually operating on patients using the compassionate use criteria was a better way to expedite progress in regenerative medicine research than using animals. And I found this quite shocking because you would have thought that after the experiences of those two patients that it would have been a time to reflect. But actually, they seem to think that what they learned was good and were suggesting that, this is the way forward. And then in November 2012, they submitted an application for funding for the RegenVox trial. So this was the larynx transplant. And this is what they wrote about Shauna in that grant application. Her case afforded an opportunity to field test the GMP procedure and protocols and quality control measures included in the present project. So it was very clear from that they saw Shauna Davison as an opportunity rather than a patient. They also falsely claimed that the operation was successful and that Shauna had died from non-graft related causes. Now, although the trials didn't go ahead, thankfully, this story is still ongoing because Viderigen got funding to do another trial called Entrust. So Viderigen got £2 million to undertake the trachea transplant trial. And I contacted Innovate UK and asked, are they happy for this trial to go ahead? And they assured me, no, it's not going to go ahead. But just a few weeks later, they gave Viderigen another £2 million to undertake this Entrust trial, which is using exactly the same technology. The patients in the Entrust trial have bronchopleural fistula. So this is where they have a hole in their bronchus. And what Viderigen were going to do was to take the deceased donor tracheas, decellularize, seed them with the patient's own cells, cut out a patch and put that to close the hole. The problem was that the UCL team had undertaken very similar tests on pigs and had found that it didn't work. So those patches became displaced, and in some cases the pigs died. That paper was not included in the references for funding for the Entrust trial. I wrote to the head of UK Research and Innovation, Professor Dame Otterline Lacer, to raise concerns about the fact that Viderigen were being given more public funding for these trials. And this is an excerpt from what she told me. She said, Innovate UK may invest in companies to drive breakthroughs with the aim that this will have high rewards to society. And this is a list of all of the Innovate UK funding that Viderigen have received. So even after I complained to Otterline Lacer, they continue to receive funding. And if you look on the website, you'll see there's no mention of the trachea transplant trial. There's no mention of the bronchopleural fistula trial, which with myself and Peter Wilmshurst, we worked very hard to get suspended. And now they've just moved on to the thymus instead. And I just wanted to highlight that Macchiarini is actually quite unusual because he did face consequences for his actions. Most people don't. Martin Birchall, has continued to get funding. And even today, if you look on his, websites, he's still boasting about his involvement in that original trachea transplant in 2008. And, he's a co-applicant on a £6 million grant to build artificial muscles now. And Mark Lodell, who played a key role in making the trachea for Shauna Davison, he received the 2024 Career Achievement Award from the International Society for Cell and Gene Therapy. So just to summarise, I hope I've convinced you that bad science can harm patients and also waste money. And bad science in regenerative medicine risks damaging bona fide research. And there is a lot of promising research in this field. So there is now a trial using embryonic stem cell-based therapies to treat patients with Parkinson's disease. And that started last year, a collaboration with University of Cambridge and a university in Denmark. Great progress has been making developing stem cell trials for type 1 diabetes. So there is a lot of optimism, but unfortunately, these type of unscrupulous individuals tarnish the field. And then finally, I'd just like to acknowledge all of the people who helped to stop the cadaveric trachea transplant trials taking place in the UK.
I want to open this up to questions, Patricia, but forgive me for the privilege of asking a couple myself. The first is, as you know, better than almost anybody, this is a massive industry across the world. You go to France, you go to Germany in particular, you go to Spain, there are all these clinics promising what are utter bogus stem cell therapies, and nobody seems to be doing anything about it. Have you had a chance to look at any of these things?
Yeah, so I mean, I'm particularly interested in what's happening in the UK, obviously. And one of the big problems is that most of the clinics in the UK, what they're offering is for patients to have a blood sample, bone marrow aspirate, or some adipose tissue taken. The cells are immediately isolated and then injected, usually into a joint, because most patients are going because of problems with arthritis or sports injuries. And at the moment, that is not regulated in the UK. And, you know, many people have asked the regulator, the MHRA, to regulate this process, and so far they just haven't done so. Yeah.
I think it's right to say there is so far no evidence that it does any good.
That's right. There's no evidence at all. Yeah.
I mean, I know because I was involved in this, because I'm a trustee of something called the UK Stem Cell Foundation. We were invited by an A-list celeb who was prepared to put a lot of money in. He just wanted us to tell him where to go, and really wasn't really interested in that. And people aren't, I suppose, when you tell them, look, the science isn't there. And we were very worried that he might just go somewhere else. There's a profound push for this. But what you have shown us tonight is not only that people are prepared to be downright corrupt, but that there's this tremendous gravitational pull of fame of when things go right. And I'm particularly interested in UCL. And I would be very grateful if afterwards there are some campaigners here, if we could join you, because we've got to get UCL to, I mean, a private company, it's going to be difficult, but UCL is based on public money. And if they don't apologise and do something about this, I mean, that would be really appalling. Could I open this? Yeah, please. Can we? I think we've got a microphone somewhere. Mandy, can I just see who else would like to? No, down. Thanks, Mandy.
We have an international police force called Interpol. Is there a case for having a scientific equivalent?
Well, I think maybe that would be a good thing. Yeah.
Maybe.
Well, I think yes.
Pressing you here.
Yes, I think yes. I think there should be consequences for fraud. At the moment, there isn't. There's no consequences for people who are involved in scientific fraud, and there should be.
I think even more to the point that we don't really have a compendium, a yellow pages, as it were, which tells us they're on this list. And that, I mean, that is really part of the problem. Could we just get the microphone taken? Can I just see who else would like to ask? While the microphone goes, has the Cell and Gene Catapult, have you been in touch with them? Because they are funding a huge amount of research in this area. Have you been in touch with them and warning them about this?
Well, actually, they were collaborating with Viderigen, so and helped them write the ethics approval form for the trial. So, so I did complain to them actually, and they were quite resistant to the complaints. But
okay, Patricia, one thing I can do, is not much I can do nowadays, but one thing I can do is put you in front of their trustees, and I think you need to meet their trustees. Please.
Thank you for the talk, and well done exposing this stuff. I'm just wondering, do you think there are any opportunities to stop these people before they caused harm to so many patients? And who might those people have been, and how might those people find these people if they're just lying about their findings like this?
yeah, I think that's a good question. I think what I'd say is, very often people do raise concerns. So, in the Karolinska, we saw there were whistleblowers there raising concerns, but they were actually ignored. I mean, what actually happened in the Karolinska is an independent investigator looked at the complaints and said, yes, there's clearly wrongdoing here, but the head of the Karolinska just ignored that report. And I think that's a big problem, really, because like Macchiarini, for instance, he's bringing in huge amounts of money to the Karolinska. Martin Birchall's bringing in huge amounts of money to University College London, you know, and they kind of want the money to keep on coming, so it doesn't serve their interests very often to actually do something about it. They're probably also afraid of reputational risk. What I would say is, you know, because people, not everybody might be aware of it, but we do have pub peer. I don't know if you've ever heard of that. So, you know, that is a place where people can, you know, highlight problems with papers if there's any, you know, clear data fabrication, and they can do that anonymously as well. So, you know, they don't have to fear repercussions. And I would advise anybody, you know, who's been given a paper to read or being given a grant to review, the first thing to do is put the names into PubPeer and see, do they have any problems with, you know, data fabrication or falsification.
It is 8 o'clock. We are about to lose our feed, and we're about to have some feed. So I think we're going to leave it there. But Patricia, thank you very, very much. And can I just say congratulations for what you've done as well, quite apart from the award. We have here a small token of our esteem.
Oh, thank you very much.
Ladies and gentlemen, Patricia Murray. Which only goes to show, I think, what Patricia's been saying, there is still a need for HealthSense type organisations. So whatever happens to HealthSense, whatever it gets folded into, I do hope we'll see you again in some form or another in the future. Enjoy your dinner. Thank you.